All right. The next one is actually someone that I am super pumped into hearing from just because his book is fantastic. And his book is 6 Foot Tiger, 3 Foot Cage. And he does have more books. That's just the one that I think is fantastic. So Dr. Liao, right? Is that right?
Yes, it's like Felix the cat goes meow, and you start with an
Liao.
so
Good, wonderful. Well, we are absolutely going to learn a lot. Again, we are going to learn about the mouth and the face and all how though that whole system can affect the body, because I have found that when I have kind of addressed all of this, a lot of things changed for my kids. So thank you so much for being here. I would love for you to kind of talk to us about what you do and how you got into this, and then we will kind of go from there.
sure. So I started out as an engineer in college. I got to dental school and I noticed teeth grinding, and that was like head scratcher number one, right? That does not make sense. Why would the body destroy the hardest tissue it has? Well, none of the answers that I got in dental school made sense to this engineer. And I got my license, started practicing. I listened to all the patients complain about their sensitive teeth, their gum recessions, their broken tooth, their need for crowns, root canals, implants, failed implants. Now what do? It's one big problem after another. I'll give you an insider secret. A family dentist business is filled with the consequences of teeth grinding. 80% of them. Okay, 80% of your dentist schedule is related to the consequences of your teeth grinding.
Oh, really? Wow.
Problem this big, okay, does not have an actual solution. Not just doesn't make sense to this engineer. So that's how I got down this path. It was a career-long search, and the search was why teeth grinding. So long story short, and I took courses in inside outside dentistry. I was an avid athlete, so I was always into physiology, nutrition, structure, you name it, I did it. So long story short, it wasn't until 2010 when the convergence of CT technology and sleep medicine led me down to this one aha moment. That during teeth grinding, you're not sleeping. All right, so that's why teeth grinding wake up tired. Now the question becomes, well, you're sleeping. Why would you want to grind your teeth? Right? You're warm, you're dark, you're under the cover, it's quiet, you fell asleep. So why would you grind your teeth? And here's the answer: you have a choked airway. Now your body is struggling to stay alive. So it is for this higher, more noble cause to rescue the rest of the body from turning blue that you start grinding your teeth. Because teeth grinding represent self-administered CPR during sleep.
Wow.
Yeah. And what we have found is that so this was 12 years ago, if you just regrow the jaw, which is now possible, now teeth grinding stop. You open your airway enough here through medicine, CPAP research. They found that if they put enough pressurized air through the choke zone here, teeth grinding stops. Okay, yeah. So now we have a way to grow the jaw without having to use CPAP or braces. And so that's what's exciting about this. But first, you have to understand the issue, which is why you end up with a 3-foot cage for a 6-foot tiger.
Right. Yeah. And so does that lead us into the impaired mouth syndrome?
Yes. So out of that discrepancy between the tongue's need to stay out of the throat and the home office between the upper jaw and the lower jaw, the space in between the two jaws is too small for it.
Uh-oh. Uh-oh. Oh, some people are still moving. All right. As long as I got movement, it's not me. I'm seeing movement. Thank you, Chantel. Oh, they're so good. Okay. We might have lost him. So how do I want to proceed here? I'm gonna kind of wait and see if he comes back. I don't know what happened. Okay. Um okay. I'm gonna come out of here and see what we can do. Oh, he's back. Woo! Keep going.
Out of this um, tooth cage or jaw cage and tongue's need for space to stay out of the throat, comes a whole set of medical, dental, and mental, emotional, and mood problems. And that really stems from airway obstruction. All right. So imagine you have to live on 10% of your income, 20% of your income, right? Life will be a real struggle.
Right.
Well, imagine if your brain have to live on 20% of its oxygen requirement, or your heart needs to live on 20% of your oxygen fuel, all right, to power the rest of the circulation for the whole body. Now you got a problem. And once you go down for the count, you cannot recover because you're in deficit to begin with. So we have found that we could open up this choke zone by widening up this jaw development. We can basically help the body to resume this form and function relationship. That is, you got good anatomy, good structure, you have good function, and you have good health. Right? That is just the most basic thing. You have a pinched nerve, what do you have to do? You got to open up that space for that nerve to exist.
Right.
Now you have pinched jaws. Now the tongue is shoved into the throat. And now the brain, the master nerve center for the body is pinched.
Wonderful. And when we look at that, and you're talking about expanding the jaw, are we looking at mouth solutions? Are those the solutions to how we can fix this oral? Is there more than one way to fix this oral space?
Yes. So we're looking at this as a non-surgical solution. Better yet, we're looking at this as genetic expression and exercising genetic expression. Okay, so how does, for example, Julia Roberts ends up with the face that she has, right? So we all know what she looks like. And so it's an example of what happens when the maxilla, which is the bone between your corner of the eyes and the corner of the mouth, and then ear to ear, the middle third of your face. It's called a maxilla. It is maximally important because that's basically the foundation from which every child grows, including you and I. We grew from here. Okay, and this function starts with your maxilla. So the maxilla needs to be wide, it needs to be tall, it needs to be long. And people who have short, underdeveloped, deficient maxillas, they ended up with what I call the impaired mouth syndrome. That's a vast set of medical, dental, brain, mood symptoms that arise from deficiencies in mouth structure. Okay. So you can get, so back to your question, based on that anatomy, you have stuffy nose, you're not gonna have a full maxilla. Okay, this is part of what we call epigenetics. What can we do to nurture full gene expression? Now you can bring on your kid's best face. Well, that's why I released a new book called Your Child's Best Face. And this is all about not even needing appliances to grow your children's best face from day one. So that everything unfolds according to God or nature's plan. all right, without the modern standard American diet interference, without the modern pollution, without the modern whatever it is that takes away from what full gene expression should be like. So that is the early parts of the dental facial development for supplying a wide open airway to supply oxygen to the rest of the body, including the brain and the heart. So in that sense, the mouth really is a vital organ that supplies all vital organs.
Yes, it does.
This is a mother that feeds all the vital organs. So if this structure is underdeveloped, then the whole body has a problem. Okay, that's why impaired mouth syndrome is a big deal. That's not even on any doctor's radar screen. Yes, and the tongue is a respiratory organ. This is a new revolution in myofunctional therapy now. They're starting to understand that the tongue isn't just for chewing and speaking and French kissing. It's a whole lot more than that. Yeah.
That's okay. So in the child's best face, what do we learn, and how can we help and make it so the child is growing their best face? What should we do in the beginning, or what should we be doing to make sure that the child's face is growing appropriately?
Great question. So can I share some pictures?
Please.
Okay. So for this purpose, I put together a little PowerPoint so that you could see a few images, because pictures better than 1,000 words, right?
Yes, I
Okay,
agree.
can you all see this okay?
Yes, sir.
Okay, good. Let me just kind of maximize this as much as we can. Yeah, okay. So how would you like your child to grow up and looking like, right? So this mid face that I talked about, it's from corner of the eyes to corner of the mouth, ear to ear. Whether it's well done, well developed or not, would determine not only the external beauty, but your internal health. Okay. This is a choked airway because this patient has this thing called the Liao sign. It's a simple 4-letter word that says this lip is not supported enough to have a oral facial convexity here. All the winners on TV and movies and ball games afterwards, they all have this convex profile, okay? Because the more convex this is, the less the tongue has to invade the airway. Conversely, the less supported this lip is because the maxilla is retruded. That's the opposite of protruded. The more the maxilla is retruded, the more airway is going to be changed. So the outside sign is when you look at a patient in profile, this is called Liao sign. Okay, so this person has Liao sign. That's why her profile does not look very human. So this is a CT image of the whole tongue. It is big. What we see in the mouth when you look inside in your bathroom mirror is just the surface part of the humpback whale. Below the surface is all of it. So here's the upper jaw, here's the upper front teeth, lower front teeth, lower jaw. Here's the chin, and cut off here is the nose and the upper lip. So what I want to say to you really is that your brain health and your airway is rooted in the facial structure. And the jaw makes up 2/3 of the facial structure. The mid-face and the lower third of the face. Okay, so if you want to have good brain function and good neurological health, you must make sure that this oxygen pipeline that supplies the whole body from head to toe, from heart to uterus, it works, okay? And so we have to look at all these 4 zones because this is how the air enters the nose. And the reason why I want to review this, because this has to do with how you bring on your kid's best face. You
Okay.
have to ensure that the nasal zone is not blocked. So kids who grow up with stuffy nose, there are going to be consequences, which I'll show you shortly. So long story make really, really short, I define a holistic mouth as one that is structurally fit to support whole body health through these functions: alignment, breathing, circulation, digestion, energy, and sleep. For our purposes, we'll just deal with ABC right now because it's going to affect all the rest. Okay, alignment, breathing, circulation. So multiple symptoms will improve. Okay, once the impaired mouth structure is fixed. But impaired mouth structure is just not on anybody's radar at this point. That's why I wrote this. So here's what you need to be looking for: the red flags. Okay, I'll let you read this out. I'll take this.
Will you read it? Tongue tie, tongue tie or tongue thrust, no lip seal or uneven eyes, narrow, uneven nostrils, chapped lips, a weak chin, ear, nose, and throat infections, teeth grinding and snoring, finger sucking, bedwetting, tired or hyperactive.
Yeah, these are just some of the clues that I can fit into this slide.
Sure.
Okay, there's more, but generally you'll see that in this view here. Just have the kid look up at the ceiling and you'll notice all these signs. Okay.
Mhm.
Head is not mounted evenly on the neck. This brain is not going to work too well, and the ears are going to be uneven. Okay. These nostrils are not symmetrical. Okay. Her lip, his lips are apart. I mean, he's got stuffy nose. Okay. So when your mouth is structurally impaired, you have polio only in the head, not in the knees. Okay. It's got whole body disruption consequences.
Well,
Okay. So here is a 5-year-old, severe teeth line. Okay. And oversized tongue and craniofacial obesity. There's no place without tongue to be. That's why he's grinding the daylight out of his baby teeth. Where's this tongue gonna go? And what are you to do as a parent or a doctor? You're gonna put it on night guard, or you're gonna put it on the CPAP. All right. The better thing to do is not to get here in the first place.
right.
Right. So this comes back to answering your question. So this is kind of like a rhetorical question, right? We all know the answer. Okay. It's a brain, right? 3 minutes and you're at risk of becoming a vegetable. So what happens when you chronically only have 10 or 20% of your oxygen that you need? Such a fundamental problem that medicine doesn't look into. And
So
it's actually dentistry that is trying to find the answer and finding inroads to the answers.
yeah.
I do want to alert everybody to Pottinger's cat studies. And these cats could not stand up because she is a 3rd generation Pottinger cat. So Pottinger cats are fed the equivalent of processed food for cats. She grew up eating cooked meat rather than raw meat. So her offspring couldn't stand up after they were born. Out in the open, there will be some praised lunch. Okay. You have to be able to stand up and run for your life shortly after you're born. So the longer processed food goes on in a family tree, the worse the offspring is. So mom, if you have a neurodivergent kid, it may not be all your fault. There are generations before you that have passed on the nutritional injuries. All right. I know it's a loaded topic, but we have to move on. Suffice it to say that the brain should have some kind of balance and symmetry. You cannot have one size more squashed than the other. The brain is actually like a rib cage, not a coconut. it breathes. Okay. And there was a study done by a osteopathic physician in 1966, or that long ago. It found that the normal intact newborns with this cranial structure that is not squashed at one point or another of the head is only 11.6%. That's 1 out of 8. Okay, only 1 out of 8 is intact normal. So that means that 1/3, if you add these two categories together, recognize central nervous system irritation and evidence of circulatory difficulty, that's 1/3. Okay, so birthing is a traumatic process on the cranium. And so you have to look for these things. So many times what she found is that instead of being symmetrical, the head ends up being squashed. And you can see what that does to the brain and its ability to breathe normally. Like I said earlier, this brain actually breathes, and the skull actually behaves like a rib cage. So a real case, 8-year-old with a head tilt and epileptic seizure. We had something over 60 seizures per hour. So I looked in his mouth and we found that he had deep overbite. That means the 3-foot cage has very low ceiling and the tongue is squeezed like a water balloon. And of course it gets shoved back toward the throat, right? Okay. So what I did was I asked myself, okay, what can we do in the least amount of time to make the biggest difference? Well, open up the overbite. Okay, so the overbite is where how much the upper front teeth overlap the lower front teeth. We got him to not overlap by building up these fillings in the back called the baby teeth. Okay, so we basically propped up his bite back here. That took about 20 minutes. No shots, no anesthesia, no Novocaine. And in the following week, he straightened.
Wow.
Yeah, and then he grew. We put expanders on. We gave him a different diet. We put him on fish oil. And then his seizure stopped. The seizure stopped.
Wow.
Yeah. So we always put our patients on a bone building diet, which simply means bone broth or minerals. This is a pair of turkey wings under some leeks and chopped tomatoes on the top, and on the bottom just celery and carrots. All right. Here it's green smoothie, the best from the plant kingdom for bioflavonoids. So vitamin C plus gelatin from bone broth. You had the precursor for making bone, the jaw, the face, and the whole body. Now, fast forward, here's pre-treatment, here's what happens 6 years later. Here's pre-treatment, here's what happens 6 years later. And that's what he looks like now. Instead of being an epileptic, he's now a church organist.
Oh.
So this is my experience. I'm not an expert in neurodivergence. I'm learning from participating with your group, and I'm grateful for this opportunity. But we see brain being affected in shades of gray fashion by oxygen deprivation all the time. That applies to adults, kids, and it's not even adults with ADD, ADHDs. It's adults with anxiety and depression. They would come in and say, my anxiety got better because I can breathe. I can sleep better.
Wow.
So there's a chiropractor who said, we did a study on hierarchy of survival reflex. What do you need to survive? Never mind thrive, just survive.
Right.
And they determined that the first thing you need is breathing.
Mhm.
Second thing is eating. And then you list them in a totem pole fashion. Okay, so your ability to stand and walk, meaning maintain your posture so that you can hunt and gather, will be number 8. Okay, and so guess who's on the very top here? The mouse.
Yeah.
Okay, so this part here must work, or else you don't have, no, sorry, it's that simple. And yet, medicine is too busy chasing symptoms and matching it with drugs.
So true.
Sorry. You know, I'm a proactive person, and I ask myself, what do I want my granddaughter to be treated with? It sure isn't drugs, right?
Yeah.
So here's another patient who came to me with seasonal affective disorder. Okay, that means every
Yeah,
4 grades.
Dr. Liao, I just want to let you know you have about 3 more minutes, and I want to be able to tell people how to find you if they have.
I'm just going to show you this case and we're done.
Yeah, perfect.
Okay. All right. So here's her airway. Okay. And these are her complaints. She has a 21% airway relative to low comfort. We did our homework. We get rid of this appliance. There's no drilling and no filling involved. Here's what she said. We have our patients fill out all these progress comments. You can see how recent this was. So this is my Wellbutrin is being dropped from 100 milligrams to 0. It will drop Lexapro in 1 to 2 months completely. Okay. So that means that we actually improved her airway. And here's the evidence. I don't have her case yet, but I want to show you this one. Okay, this is after braces, before she came to me, because she's gone through her nightmare. We did it our way. And here's the evidence. We more than triple her airway in volume. We more than double her airway in cross section. Okay, so the more white and blue you have, the wider your airway. 4-lane highway, 1-lane highway. Okay, so this is the book, and you can read more about it.
So good and so like fascinating, really. You know, it's just you would think that this was you know, obvious a little bit, and maybe that's the wrong word, because obviously it hasn't been obvious in all of these years that you don't want your kid on drugs. You want him to be able to breathe and grow and do have enough room for all of these things. So it's just fascinating, the work that you do, and I appreciate you being here and taking the time to do this. Dr. Liao, is there a way that people can get in touch with you if they have more questions, if they want to hear more?
Yes, let me just put on the screen here for everybody to get in touch with me. Thank you for your interest, and I appreciate the opportunity to share this with you.
And then we did put some way to get in touch with him and his free gift right there in the chat, everybody. So thank you so much for grabbing that and getting in there to get that free gift from Dr. Liao. So thank you again.
Sure, delighted.
Have a wonderful day. I do appreciate your time and your teaching and your knowledge. So thank you again.
Very welcome. Bye-bye. Have a great one.
Yeah, you too. Thank you again.
Yep.
Right. Well, I don't know about you, but I find that so fascinating. It is just so, I don't know, to be taken down roads that you really didn't know that was out there is the whole point of this, right? I'm trying to educate you and give you so many roads to go down that you can say, oh, this is my person. Oh, I'm going to try that one. Again, check things off and move it along. Don't have to worry about that anymore. Oh, breathing is good. Check that off. All of those things, because that is amazing that we got rid of seizures and you got rid of antidepressants by increasing blood oxygen. right? By increasing the oxygenated blood so it could feed all the parts within your body. And that is what oral facial myology is, right? That is what we are doing. We want to open up the airway for the kids.